Your child is in the early stages of a psychotic disorder. You look at the doctor in disbelief. What are you talking about? How can this be happening? What did I miss? What does that even mean? This must be a mistake. Who else can I ask? This must be a mistake. What now? Hello. I'm Dr. Patricia Harrison-Monroe, the Vice Chair of the Department of Psychiatry at the University of Arizona College of Medicine and the Director of the Early Psychosis Intervention Center, also known as EPICenter, in Tucson, Arizona. We hope that this brief educational video helps to answer some basic questions you may have if you are the parent, family member, or caretaker of a young person exhibiting symptoms or newly diagnosed with a psychotic illness. Early psychosis, also referred to as first episode psychosis, is usually seen first in adolescents and young adults. Families often ask, why did this happen? What is important for you to remember is that there is not one thing that causes this illness, and we have moved well beyond the early ideas that families and their parenting practices are to blame. Research tells us that there are a variety of biological factors and environmental stressors that may raise the level of vulnerability to develop a psychotic disorder. Psychosis is a condition that affects the way your brain processes information, causing a break of sorts with reality. It results from a combination of genetic and environmental factors. Although there are several genes linked to psychosis, there is not one specific gene that researchers have identified that causes psychosis. And while there is a strong genetic link, such as the existence of mental illness in other family members, not all individuals in the early stages of psychotic illness have such a family history. Some of the more common environmental risk factors that increase the vulnerability of developing psychosis include some types of birth injuries, such as pressure or trauma to the head or a lack of oxygen during birth. Exposure during pregnancy to viruses or toxins, as well as poor nutrition and limited prenatal care, can also be risk factors. And substance use and exposure to high stress or trauma have also been linked to increased vulnerability. To consider a diagnosis of a psychotic disorder, we generally look at positive and negative symptoms, as well as the duration of those symptoms and whether they are drug-induced. The designation of positive or negative symptoms does not mean that they are good or bad, but rather that we know that they are there because of the way they present and how we approach treating them. A common positive symptom is that of seeing and hearing things that others can't. Those are called visual and auditory hallucinations. They can often start with small things. Your child may hear a noise, knocking, a whisper, often behind them. But when they turn around, nothing is there, and they ignore it until it happens again. Sometimes a young person will see movement or shadows in their peripheral vision. But when they turn their head to look, nothing is there and they ignore it until it happens again. Sometimes hallucinations can also affect what you think you smell or taste. Occasionally, your child may have the feeling that something or someone is touching or pushing them, even when no one is there. Even when this starts to happen more frequently, a young person may not tell anyone, including people they trust, sometimes for several years. Parents may not notice, initially thinking that their child is just, being a teenager and will eventually grow out of the odd behaviors they're starting to notice. Or parents will worry about drug use. Often, however, such symptoms first come to the attention of teachers, who then contact the parents and recommend an evaluation. There is another way psychosis can present. Sometimes the brain misinterprets information and convinces someone that the information is correct even when it's clear that the belief is wrong. That is called a delusion. As a result, someone may believe things that are not true. For example, some people think that someone implanted a tracking device in their brain, or that they are being followed, or that the announcer on TV is sending special messages to them to warn them of a threat. You may also notice that your child's speech is changing. She may start mixing up words and become more difficult to understand. She may stop initiating conversations or limit responding to you with only a few words, maybe even just a yes or a no. Your child may choose not to eat meals with you, put items in unusual places, or repeat certain words or movements for seemingly no purpose. Often, they may not be aware of this change in their own behavior. To address positive symptoms, psychiatrists will generally prescribe types of medication called antipsychotics. As I said before, negative symptoms are not worse. They're just often more difficult to notice because they seem to develop more slowly. Some examples include lack of affect, which means that the person does not seem to experience or express a variety of emotions. Looking at your child, you may not see them making facial expressions of surprise or happiness or sadness. Another example is lack of motivation to do or try anything. Your child can also seem to have less interest in things he used to enjoy. Social withdrawal and isolation also often develop, particularly in the early stages of the disease. You may realize that fewer friends seem to come around, and sometimes your child does not seem to notice or be too upset by that. Negative symptoms contribute to social and functional decline and can remain even when positive symptoms are managed with medication or no longer evident. It is important to understand that negative symptoms are often present for weeks or months prior to the start of positive symptoms. When this happens, they are called prodromal symptoms. A change in cognitive functioning is also often evident even before positive symptoms present. So you may notice your child having significant attention and memory problems, as well as difficulty in decision-making. Your adolescent or young adult may have problems doing simple tasks that they used to do with no problem, such as taking care of their personal hygiene or going grocery shopping. They may seem confused about the order in which to do certain tasks, even with reminders and support from you. This can be very distressing to witness and often confirms to you that, yes, something is very wrong. As I mentioned before, treatment often includes psychotropic medication, such as antipsychotics that work in the brain to reestablish the balance of certain brain chemicals that we know affect perception, resulting in auditory or visual hallucinations. Sometimes your child may also experience mood fluctuations and may be prescribed something for anxiety or depression. However, medication is just one part of treatment. A comprehensive, specialized, and individualized treatment approach, often referred to as psychosocial treatment, is important. Some of these interventions include cognitive behavioral therapy for psychosis, also referred to as CBT-P, metacognitive remediation to help individuals address specific cognitive deficits such as memory, peer support, social skills training, as well as a focus on educational and vocational support to facilitate the individual's return to optimal functioning, and education for families so that they can better understand what is happening to their loved one and how best to support them. The best outcome for psychosis usually occurs when an individual participates in both medication and psychosocial treatment. A major challenge for families of individuals in the early stages of psychosis is that there are few clear answers. Sometimes even the diagnosis is uncertain, as is the best treatment approach and what the future will hold for him or her. Families struggle with worries about whether their child can ever finish school or return to work or ever be in a happy relationship and eventually have children of their own. The first few years of a psychotic illness are referred to as the critical period. That is because most of the functional deterioration happens during that time, and the level of severity of symptoms is often an indication of how severe this illness will be in the future. It is also the time when psychotic symptoms are most responsive to treatment. supporting the research findings that the earlier your child gets into treatment, the more effective the treatment can be. The stress diathesis model of symptomatic relapse tells us that certain stressors can trigger a relapse and recurrence of psychotic symptoms in your child. However, the goal is not to eliminate all stress in your child's life. The goal is to reduce unnecessary life stressors and help your child learn strategies to cope more effectively with such stressful life events. An important part of this is also for you and your family member to recognize the early warning signs of a potential relapse. Here's a list of things you may observe that will indicate that your child, who has been well managed in early psychosis treatment, might be experiencing a relapse. Every relapse increases the likelihood of your child having a harder time to return to previous level of functioning, developing some treatment-resistant symptoms, and possibly needing to increase the dose of their medication. Therefore, the role of the family in recognizing early warning signs and preventing a relapse becomes very important. Research has shown that families educated on signs and symptoms of a psychotic illness and who learn how best to interact with their child can vastly contribute to an improved outcome. Our program, the EPICenter, is one treatment resource if you live in Southern Arizona. We offer phase-specific, evidence-based treatment of early psychosis for up to 5 years. Services include individual, group, and family therapy, metacognitive remediation, medication assessment and management, peer support, educational and vocational support, social skills training, expressive arts, family support services including psychoeducation, as well as health and wellness activities. Our services are comprehensive, bilingual, and covered by ACCESS, which is the Arizona version of Medicaid, as well as by most commercial insurance plans. There are an increasing number of specialized early psychosis intervention programs around the country, following several evidence-based treatment models. The research continues to show that early intervention is key to increasing a person's chance of recovery. So, I urge you not to ignore the signs and symptoms that your child may need mental health support. Don't despair. Look for services and programs that specialize in early psychosis intervention and get your child evaluated. Thank you very much for watching this video. I hope it was helpful in providing you with an overview of the signs and symptoms of early psychosis. It is certainly our desire to encourage you to obtain more information on this topic and learn how best to help get your child the services they need. Please reach out to us by visiting our website or contact us via email or call. We are here to help. Thank you.